everyone. So today's topic is control of diarrheal diseases. While controlling this disease, we have short-term goals, means to cure the disease as such, and long-term goals are regarding the control of disease in population that we will study later on. Now, WHO and UNICEF firmly believe, and it is established that O.R.S. is what is required in the treatment of diarrheal diseases mainly. Now, this O.R.S. is believed to be given in any etiological condition for diarrhea of any age patient, and whether any disease the diarrhea is in any country, and it is found as safe and successful in treatment of diarrhea. Let's go further into the details of oral rehydration salt. Okay, so this is a salt that mainly consists of sodium chloride, glucose, potassium chloride, trisodium citrate, and yeah, these are the four constituent. Before trisodium citrate was used, it was bicarbonate that was in use. So here, what is the principle? It is that when oral glucose is given, it increases the absorption of sodium and water, and hence balancing the electrolyte deficit in the body. Now, earlier we used to use sodium bicarbonate, okay, but now we use trisodium citrate. This is because this chemical compound is found to be more stable, and plus it decreases the stool output, plus it itself increases the absorption of sodium and water. This is why in the place of sodium bicarbonate we have started using trisodium citrate. Now, talking about reduced O.R.S., we found out that when we reduced the osmolarity of the solution of O.R.S., which was around 300 something, we brought it down to 245, and we saw that there was decrease in need of IV fluid therapy by 33%, and decrease in stool output by 20%, and vomiting was decreased by 30%. That is why we now have transformed to using a reduced O.R.S. solution. Now, what is reduced O.R.S. solution? Mainly, we reduce the concentration of glucose and sodium to 75 milliosmol per liter. Here we have sodium as 75 milliosmol per liter, glucose 2 as 75 milliosmol per liter, chloride as 65, potassium as 20, and citrate as 10. So this whole comes out to be 245 milliosmol per liter. This is what reduced O.R.S., which decreases these things in this order. Okay, next let's talk about when we will give O.R.S. and in what concentration. So when dehydration is set on, okay, which is characterized by seeing the signs like urine output, the skin dryness, the tongue wetness, or the anterior fontanelle, if it is shrink, that is a sign of severe dehydration. So after watching all these signs, water deficit in dehydration is about 50 to 100 milliliter per kg of body weight. Now to correct this, we give the O.R.S. at a rate of 75 ml per kg of body weight. This is what the O.R.S. is given at this concentration, and for every episode of stool, next we add 100 ml of O.R.S. solution. Now after giving this O.R.S., okay, oral rehydration solution, there is a chart for knowing how much of O.R.S. to give at what age and what uh, weight of the patient, but that would be too lengthy to discuss now. So let's move further by discussing that what is the requirement of O.R.S. So in children we limit the use of O.R.S., but in the cases of adult, it is said that O.R.S. is used as much as they want, okay, and plus until the signs of dehydration have subsided. Now, one more thing we need to remember is that when the child is of less than 2 years, we give teaspoons of O.R.S. every 1 to 2 minutes, and then we give a sip by cup, okay, when the child is ready. And this is we try to give the dose within 4 hours. Now what is the dose, we will be discussing soon. Now let's talk about the dose. Okay, so dose, as we know, is 75 milliliter per kg of body weight. Plus there is a chart which you should look into the park. So for every one stool that the child excretes after the normal output, we give 50 to 100 ml of ORS if the child is less than 2 year, 100 to 200 if the child is between 2 to 10, and in adult, according to his want, we give the ORS. Now if the child vomits out while drinking ORS, we wait for 10 minutes straight, and then we give sips of again the ORS solution, and then giving the sips of cup. Now, important thing which we should remember as a clinician is that uh, we should avoid or we should advise the patient not to use sweet drinks. Okay, these sweet drinks include any carbonated beverages like Pepsi, Coca-Cola, or any juices from the market, fruit juices, because they contain a lot of sweet, and the tea and coffee. Okay, all these things which may also act as purgatives like coffee. Now, why this is avoided? Because it will cause osmotic diarrhea. Okay, these all the sugar will act as a hyperosmotic agent and will lead to an osmotic diarrhea. Plus, there may be hypernatremia. This is why we should avoid all the sweet drinks during diarrhea. Okay. Plus, we should also know that some countries have started recommending house fluids. Now, these are when we include salt in some of the fluids that do not contain it, like cereal water while it is being cooked, that is rice water, or unsalted soup, yogurt drinks. Now, the mothers are taught to add salt, that is around 3 grams per liter. Okay, and this during diarrhea helps a lot. Okay, the most important thing is we should remember to avoid sugar. Now there can be a homemade solution that can be made in home, that is in a ratio of 1 is to 6, 1 part of salt and 6 part of sugar in 1 liter of water. Okay, and we should remember to consume it within 24 hours, and not to store it, and not to boil this solution after it is made. Next thing that we can do is IV rehydration. Now this is done in severe cases of dehydration where patient is unable to drink, and this is given at a rate of 100 ml per kg. And in these cases we prefer ringer lactate, that is a Hartmann solution, rather than the diarrhea treatment solution. Also, this diarrhea treatment solution is an ideal polyelectrolyte for diarrhea, but ringer lactate is still considered the best thing. Okay, because here not only it corrects dehydration, but in severe dehydration there occurs acidosis. Here ringer lactate gives lactate which yields bicarbonate and hence help in treatment of acidosis. Now major thing we need to remember in this is, if nothing is available, we do give normal saline, but we should change to these above solution as soon as possible, because normal saline is poorest of the one in dehydration, because it lacks the important electrolytes and does not correct acidosis as well. Now how do we give it is that if the age is less than 1 year, we try to give 30 ml per kg. Okay, so total we had to give 100 ml per kg. So in first hour we give 30 ml per kg, and in next 5 hour we give 70 ml. And if the age is more than 1 year, within 30 minutes we give 30 ml, and two and a half 70. Now what is all this is that when there is severe diarrhea, we try to give initially the rehydration at a greater at higher speed, so as to correct acidosis and dehydration as soon as possible. Okay, and here we use the 18 gauge needle, that is a wider bore needle, and as soon as patient is stable, we change it to ORS orally at a rate of 5 ml per kg per hour. Now we reassess the patient every 1 to 2 hours and look for whether the signs of dehydration are still present or not. And the two important signs that help us to do so is skin elasticity and pulse strength. A skin elasticity uh, is a very important thing. Okay, if the skin is if the skin retracts very slowly, means taking more than 2 seconds, it is a sign of severe dehydration. Okay, now let's move on to another part of the management of this condition, that is chemotherapy. Now we should remember that we have to avoid unnecessary chemotherapy. Means until and unless we are sure about the cause, like if it is Shigella, we have to give the drug of choice ciprofloxacin, and if it is cholera, we give doxycycline or tetracycline. But in other causes where the cause is unknown, rather stop or avoid using any antibiotic. Okay, plus there are many antibiotic that need to be avoided because of other causes like neomycin and other drugs that you will study in later part. Another thing is that zinc is given because it decreases and prevent further episode of diarrhea for 2 to 3 months, and this is given at a dose of 10 mg for less than 6 months of age and more than 20 mg at more than 6 months of age for 10 to 14 days of interval. Zinc is very important to be given, and it is found to be very effective. Okay, and another thing is that long term talking about the long term management of this condition, the two things are: we have to give a better maternal child health care, and